Vital signs procedure in nursing Ghana. In this video, I'm going to give you anything you want to know about vital signs procedure in nursing Ghana. So, watch this video till the end. Okay. In Ghana, as in many other countries, nurses follow standard procedure to measure and record vital signs to assess a patient's overall health. The key vital signs include temperature, pulse, respiratory, blood pressure, and sometimes oxygen, and then pain level. Okay, so we are going to take it one by one. How to measure all these things I have mentioned. Okay, so the first one is temperature measurement. So temperature measurement. The equipment you use to measure the temperature is clinical thermometer. Okay, so how do you use clinical thermometer to measure patient temperature? Okay, so procedure: clean the thermometer, place it in the selected seat under the tongue of oral reading. Wait for the required time or for digital thermometer. Record the temperature in degrees Celsius and then clean and then store the thermometer properly. So after you have used it to check the patient temperature, you have to clean and then store it properly. And the next one is pulse measurement. So these are the equipment used to measure pulse. Okay, so equipment is non-manual or pulse oximeter for digital reading. Procedure: locate the pulse site, radial for routine check. Use index and middle fingers, not the thumb, to feel the pulse. Okay, so you use the middle finger. Which one is this one? Is middle finger. Don't use your thumb, which is kokorobuti. Don't use that one. Okay, so count beats for 1 full minute or 30 seconds and then multiply by 2. Okay, so when you check it, then you count the beats for 1 full minute, which is 1 minute, and then or 30 seconds. Okay, and then multiply it by 2. Okay, and then record the beat per minute and note the rhythm and the strength. So you record the beat per minute, as I said earlier. And then the next one is blood pressure. So how do we measure blood pressure? And then what is the equipment we use to measure blood pressure? Okay, so the equipment we use to measure blood pressure is thermometer. Thermometer is manual or digital, and then the stethoscope. Okay, stethoscope. So these are the procedure. Ensure the patient is relaxed. So when you are checking patient's BP, make the patient relax. Okay, and then wrap the BP cuff around the upper arm at heart level. Okay, so you wrap it here. As you always know, when you go to hospital and then you're going to check your blood pressure or BP, okay, they use it to wrap your upper arms. Okay, and then inflate the cuff slowly, release pressure. If using a manual BP monitor, listen for the first and last cough sound. So you listen to it. Okay, the sounds you listen to it first and then the last cough. And then the next one I'm going to give you is general guidelines for vital signs measurement. General guidelines for vital signs measurement. Okay, so point one is always wash hands before and after the procedure. So when you're going to check the patient BP or measure the patient's BP, you have to wash your hands, and then after the measurement or after checking it, also you have to wash your hands. And then the next one is um always always wash hands before and after the procedure. And the next one also is ensure privacy and comfort for the patient. Okay. So after checking the patient's BP, don't tell the patient that hey, your BP is too high. What did you do at home? Is there anyone causing or is there anyone do something bad to you? Please don't tell the patient that. Okay, comfort him. Even um the patient's pressure is low or high, please don't let the patient know, or comfort her or calm the patient down, okay, so that it won't cause anything. And next one is use the same site for consistent reading. Record findings accurately in the patient chart. So when you check the patient chart, make sure to record it, okay? And then report abnormal value immediately to a senior nurse or doctor. So when you saw any abnormal value, what you have to do is you have to report it to your doctor or your senior nurse. Okay. So this is the vital sign procedure in nursing. Okay. So thank you for watching it, and see you in my next video. Please don't forget to subscribe for more videos. Bye.